We've got to build public confidence in what the government is doing for the population. We've also got to engender some trust so that people go out and get vaccinated. And I think we do have a responsibility as an association to do that, and as clinicians. But at the same time, I think we need to call out its failings, and there have been repeated failings. No doubt there will be a public scrutiny post pandemic at some point in time. And they will look at a whole variety of things. They will look at how we've managed to get timely communications out to staff. They will look at how we safeguarded the population. Did we go into lockdown at the right time? Should we have done it sooner? What about the absolute omni-shambles that track and trace initially was? Is it really working now? What about the systematic underfunding of services, all healthcare services, but specifically public health, who actually would have had a really pivotal role at the start of the pandemic had they been appropriately funded at the right time. But instead they were depleted over many years. And we reap that. We reap what we sow, don't we? So it's I mean, I can carry on. How long have you got? I think that the word I'd want to use is shambles, but I do take us back as healthcare professionals. We will do our job as we have done through the pandemic.
But it's still shambolic today. You still feel it's shambolic.
Well, look at what we're just talking about with the vaccination program, right? We're talking about how we're unclear about where people are being prioritized. We know the two key priority groups at the moment who are getting vaccinated, but even within that, we're saying to you, health and care workforce, we're unclear about how they're being prioritized. Well, what does that say about confidence in terms of the government strategy? So I think we've got to be mindful that there have been repeated failures.